We have something I consider a real treat here for you today. You know, when we think of Mu'mineen in the United States, and we think of Jamaats in the United States, we think of Houston, we think of Los Angeles, we think of Chicago. But this group out of Atlanta, in a relatively small Jamaat, has done some amazing work, and it deserves to be recognized. And in fact, it has been recognized. For the first time in its history, the American College of Physicians invited this team to present their findings. And the reason why it was a first was it was the first time the American College of Physicians invited high school students to present on medical research. These are our high school students working in our community, looking at data in our community, and the American College of Physicians saw fit to invite them to present on their research. So of course we are going to invite them to present on their research. So it is my distinct honor and pleasure to invite the Umur Sehat, part of the Umur Sehat team from Atlanta. We have Taha bhai Mustafa, we have Amatullah Fidahussein, led by Dr. Major Salman bhai Fidahussein. Bring them up to the stage to present the groundbreaking work they've done on preventative health in Mu'mineen.
I'm going to be real brief, and I'm going to pass it on to the students. Obviously, it's been an outstanding day from Shehzad Saab, then Hassan Bhai Saab, followed by amazing talk of genomics. So it's a tough act to follow, and we recognize that. But I could not be more proud of the students. I remember when we had a video conference during Ramzan by Shehzad Saab, and one of the things that he emphasized on that was, but अपना future नुसु था से, तमें बदु करो चो बराबर से अपन अपना फर्जों दो केम कर से, ने वो लोग कहने तमें केम mentor कर सो. There was a very big emphasis on that evening when we had that 15-30 minute call with Shehzad Saab, and we have taken inspiration from that. You know, this is a bold statement, but I imagine a world where every single child in our Jamaat can be uber successful, right? Imagine a Jamaat as such. Why should any child be left behind? We have so many resources where every single child in our Jamaat is going to be successful in the future. And that is my hope, and I truly do dua, inshallah ta'ala, one day that will be true. So without further ado, I'm going to pass to Taha, Mustafa, and Amatullah Fidahussein.
Hello, everyone. My name is Dr. Taha Mustafa. I'm kidding, I'm not a doctor yet, but in the event description, it said I was a doctor, so I'll take that title happily. But yeah, inshallah, one day, all jokes aside, I do intend on becoming a doctor, inshallah. So yeah, Molani dua si inshallah, main doctor bani jaun. And here's my partner.
Hi, I am Amatullah Fidahussein. I'm also not yet a doctor, but inshallah, in the future, I will be. And me and Taha, along with so many other people, brought Project SHIFA and Project BARAKAH to life. Project SHIFA and Project BARAKAH are a community health initiative towards making our community more health literate and more understanding of what health is and how to prevent diseases in our community.
All right, so I just want to start off by saying one of the good things that lies in our community, and this is very much so thanks to Mola and the wa'az that he gives. He always recognizes how important health is, how important it is to be clean, to be healthy. And because there's a lot of religious groups out there who are minorities, and they don't really place a big emphasis on health in the community. But thankfully, thanks to Mola and the teachings he gives us, we recognize how important health really is and how important it is to be healthy and clean. So just one of the examples that exist is Mahalo SHIFA, right? So in Ashra, year after year, in Karachi, in India, in Houston, there's Mahalo SHIFA health clinics and health camps that exist. So these are run by Mu'mineen doctors like you all right here. And it just really shows how we take a great emphasis on the health and well-being of our community members. And this is all thanks to, you know, what Mola teaches us and what he encourages us to do. And there's also permanent camps in Mahalo SHIFA in Karbala and Najaf. So, and these serve more as like an emergency type of care center. So these are just some things I want to touch about, how it's just so great that because what Mullah teaches us, we are able to create a sort of camp that we really value healthcare in our community and we care for each other and our sehat.
Yeah, Taha said it perfectly. We have such a huge emphasis on healthcare, and it's amazing. And a lot of what our research hopes to do is to make it so that Mahalo Shifa doesn't have to be emergency care. It can be long-lasting, long-term care for our community, and it can be available to us at all times. So Taha's going to give a bit of an overview on Project Shifa before we go more into what it is.
All right, so here's a brief overview of what exactly we did, right? So our Atlanta Jamaat, we had an interest in healthcare, right? So we would do, different doctors would come and they would give different talks about different things like, let's say, high blood pressure, for example, right? And what we noticed was a lot of the Jamaat members, they weren't really paying attention. Like maybe 20% was actually paying attention. The rest were, doing their own thing on their phone, etc., right? Because, and we realized this is because we're not targeting a certain issue, right? A lot of people, it's like, for example, if we're giving a lecture on why it's important why is it important to check your blood pressure, and majority of people already check their blood pressure, right? It's not going to be very engaging to the people because they already understand why it's so important, correct? So what we wanted to do was identify exactly what it is that is missing in our community, and that is how the idea of Project SHIFA and Project BARAKAH came into place. So Project SHIFA is basically when we collected data, we sent out a survey, we collected data on different health issues that exist, like different screening types, mental health awareness, sleep health, and we compiled this data and compared it to Georgia State averages using the US PSTF and AAFP guidelines. And then with these findings, we launched Project BARAKAH, which is basically the actions that we will take to kind of, and I'm going to talk about this further in the talk as well, but to kind of close the gaps that exist in our community so that we can not only improve the health of our Jamaat, but we can also talk about something that is important to people and something that people actually struggle with, rather than a very general talk about, why is it important to check your blood pressure or something like that. So yeah, now Amatullah is going to talk a little bit about the objectives and methodology.
So as Taha began by saying, our Atlanta Jamaat took a big interest in our healthcare a little over a year ago now, and they wanted to know more about how we could stay healthy, how we could eat better, how we could become healthier as a community. But we were giving these talks over how to have better dental hygiene, how to eat better, how to be more active, but that wasn't what we needed. Our Jamaat wasn't struggling with those things, but we didn't know what we were struggling with. So along with Dr. Salman, we were able to launch Project SHIFA, in which we found where did we actually need this help. So with a survey that was sent out to the entire Jamaat, we were able to collect data over basic medical areas, such as screenings, or whether or not we were getting vaccines, whether or not we had primary care physicians. We were very fortunate that about 80 out of the 120 surveys we sent out came back to us with very good results. We found that we had our struggles, but we also had very large strengths. Significantly, we realized that the majority of our Jamaat did have a primary care physician, and the majority of our Jamaat was getting their vaccines. However, our weaknesses mostly laid in our screenings. We weren't getting mammograms. We weren't getting colon cancer screenings. We weren't getting these screenings that were necessary. And another significant result we found was that we weren't getting help for our mental health. Through the survey, we found that a lot of our Jamaat did struggle with mental health issues, such as anxiety or depression, but weren't seeking help for it. This was a little look at what our survey kind of outlined. Our survey also was very private. We made it clear that this was all anonymous. Your name was not going out there. We weren't targeting people with it yet. When Project BARAKAH, we did want to make it more individualized. We wanted to be able to seek out those who really needed the help on certain things. So yeah, our strengths were the high vaccination compliance and strong dental and eye checkup rates, along with high amounts of people having a primary care physician. The low colon cancer, cervical, and cholesterol screening rates, low HPV vaccination rates, and limited mental health help seeking was concerning, especially considering how high our primary care physician rates were. Taha's going to get more into the key findings now.
Yeah, so Amatullah said it perfectly. What we found was that our main strength lied within we had high PCP rates, higher than the state average actually, and we also had high vaccination rates. Along with that, we had strong dental and eye checkup rates as well. But the thing that was really alarming, and when we presented this at ACP, the American College of Physicians, they were also pretty surprised by this, was that how do we have such high PCP rates, however, our screening rates are so low, right? This doesn't make sense because the primary care provider would encourage us to get these screenings because we as medical professionals and people interested in medicine know that early detection of any disease such as these cancers can truly mean life or death, right? So is this something to think about? And what we believe is that because, like, for example, our most significant gaps lied in prostate cancer screening, mammograms, pap smears, and colon cancer screening, right? So the thing that we believe is that in our community, there exists a sort of cultural stigma, right? Like these are private, and if they don't bother me and if I don't feel like this is a problem, I should not get it checked. This is a mentality that exists in some members of our community, which we need to try to, distinguish because, as I said earlier, early detection of some of these cancers or screenings could truly mean the difference between life and death. So what we intended on doing with Project Barakah was to educate the community on why exactly is it that we should be getting screened regardless of if we feel that it is necessary or if it is not necessary, and to kind of break the cultural stigma that exists, and especially talking about mental health, right? A lot of the people in our community, we believe that, yeah, okay, you feel sad, well, it's okay, it's not a big problem, just, get better. Well, we know that that is just truly not the case. Mental health is very real and it's a very serious medical issue. Anxiety, depression, they are very largely, they lead to a lot of suicide rates in the world, right? So the whole goal of Project Barakah was to try to educate and provide initiatives that could close these screening gaps in order to, in the long term, strengthen the health of our community by increasing screening, increasing mental health awareness, and things like that. So here's just a quick infographic you can see. So out of the people that we surveyed, 30% signified that they had mental health issues. But out of that percentage, 85% would not seek any help for these mental health issues. And this is really alarming because it just shows that we just tend to, deal with it. Like if you feel sad, like, okay, it's not that big of a deal, but, it truly is, mental health is really important, and we should be getting therapists and things like that to try to decrease what we're feeling and things like that. So, and we can see in the graph here, the one on the left, the gap analysis. So this really is a good visual to just see the local rate versus the state average of what we assess. So again, mammogram, cervical cancer, diabetes, prostate cancer, we can see how this local rate of screening is much lower than what the state rate is. And again, I repeated this several times, but our main goal was to try to close these gaps in order to, build a more healthier and more structured community in the long run. So that is what we're gonna get into, Amatullah is gonna get into now, talking about Project Barakah.
Okay, so Project SHIFA obviously got us this data, and the question was, what do we do with this data? So Project Barakah came to life. Project Barakah stands for Bridging Awareness, Risk Assessment, and Knowledge for Active Health. The point of Project Barakah was to take these results and teach people what to do with these results. Project Barakah began with us putting a poster up in our markas, which detailed what we had found, detailed what we just told you. All these things we were telling people, like, check your blood pressure, get these screenings, were now backed up by evidence and data that we found. These were issues, and people were now able to see the data proving they were issues. Additionally, Dr. Salman made a presentation and basically told the Jamaat what we were doing. What is Project SHIFA? What is Project Barakah? He shared that with the Jamaat so they would have an understanding of what their data was being used for. We also held a small health clinic of a sorts, taking people's blood pressure, getting people to seek out help for issues they were already struggling with. They could talk to doctors and physicians around the Jamaat, and they could basically share what they were struggling with, and they could be recommended what to do with that. Additionally, we put out posters during Muharram, which Taha will talk a bit more about.
Yeah, so, and I just want to touch back a little bit briefly about Project Barakah. We had such good, the community was so supportive of what we were doing. We had doctors like Dr. Shazia Naib in the audience, and we had Ibrahim Bai Izzi, who would help us in these clinics and these initiatives, talking one-on-one with these patients and trying to really identify what is going on and what we can do to try to help them, right? So, yeah, going back into, during Ashra, we had 8 posters that we would share with the community every day. And so the main goal of these posters were to sort of just keep it very simple and sweet for the people to really understand why is it important and the risks that are involved if they're not screened for, right? So we would just share these with the community, and I just want to go a little bit in depth into, let's say, for example, the hypertension awareness poster, right? We can see that we kept it very simple and sweet. Why is it important? Because many members in our community may not realize that they have high blood pressure, and it can lead to various complications. And in the risk, we aim not to, say, scare people into like, oh, it's really bad, you should get screened because this can happen. But we just needed to wake them up to reality that truly, if you do not get these things checked out, and if it's not checked early and it's not detected early, it could truly be life-threatening, right? So, like, for example, the risk as a result of untreated hypertension, it could be heart attacks, strokes, and kidney failure, often without any noticeable symptoms. So all the posters that we released, it was one about mental health, one about sleep health. They're very short and simple, and they allowed the community members to really understand, like, okay, I don't do these screenings. This is why it's important, and this is what I should do and why I should do it. Because we need to give them a purpose. Like, if you just tell them, yeah, you should do it, but then they would be like, it's going to be the same thing. Yeah, I feel fine. I don't need to do it. But by telling them the risks that are involved in not getting screened, we were really able to kind of convince them and motivate them into getting these screenings and these issues checked out. And here are some other posters that we also had, one about diabetes, one about cervical cancer, prostate cancer, and they all revolve around the same theme of keeping it very nice and simple and able to deliver a very meaningful and impactful message to the community.
So Project Barakah was very successful so far. However, it's not over. Next Ramzan, we are hoping to send out the same form that we sent out last year and see if we made any difference in those gaps. See if we can, once again, get our data analysis team to look and see if we close those gaps at all. See what else we can do. Track these measurable improvements and continue data-driven, culturally sensitive interventions so we can bridge these gaps even more and create an even more medically driven community. We were very fortunate that Dr. Jamali reached out to us and asked about making this a national survey. We did not obviously come to the realization that this needed to be something that was sent out across the United States. It was something that all Jamaats needed to see. So we adapted our survey. We made it more manageable for all Jamaats, and we'll take a look at the survey now. Maybe. Taha will tell you about the survey since the link is not working.
All right, so basically in the survey, it initially asks it gives a quick brief overview of what the survey is for, how it will be kept anonymous, and so there was actually an option of it could be anonymous or it did not have to be anonymous, and this is simply because if someone wanted it to, okay, perfect. So now you guys can also see how the survey looks. So yeah, as I was saying, we talked about the confidentiality involved and how what the purpose of the survey was in order to get a good understanding of all Jamaats across North America, not just in our Atlanta Jamaat. So then it had some basic demographic information. As I said earlier, you could put your name and or you could choose to be anonymous as well, because the main goal that we had was to try to collect as much data as possible so we'd have the best idea of exactly what issues we are struggling with as a community in North America rather than just in Atlanta. So we had also a Jamaat affiliation to select what Jamaat you're from so we could have the specific insights on that exact Jamaat, right? And then so here's the first section. So it's about cancer screening. It asks simple basic questions like, do you have family history of cancer? Have you had a FIT test? Do you have a mammogram within the past 2 years? So these were all some important questions that we asked in order to collect data about how the cancer screenings compliance were throughout North America. Then we had a section about heart disease screening, right? They asked simple questions like, have you had blood pressure checked in the past year? Have you had cholesterol checked in the past year? Have you been screened for diabetes? All which we all know are very important to one's health, and we had to make sure to collect enough data to assess if people are doing this in Jamaats across North America. Then we also had a section about vaccinations. Earlier when we did our survey in Atlanta Jamaat, we realized that our vaccination rate was high, right? So we wanted to see, was this just a trend in Atlanta, or is this common throughout North America? And why is this common, right? So the questions were simple. Well, have you received flu shot? Have you received a COVID shot in the last year? Have you received an RSV vaccine? Have you received shingles vaccine? So these were all some essential vaccine information that we just asked to collect in order to assess that is this high vaccination trend common for all Jamaats across North America, or is it just isolated to the Atlanta Jamaat? And then lastly, our final section was some general information, right? This touched on a little bit about mental health, right? Because again, we all know how important mental health is and how it's not talked about often within our community because of the stigma that exists with getting a therapist and things like that. But even Mola Farmao's in multiple vases how important it is, how important mental health truly is, and that it is not something that should just be pushed to the side or downplayed in any way. So that, and then finally we just had some questions about if they visit a dentist, if they visit an eye doctor, because as we realized, we in Atlanta Jamaat had a high compliance for PCP rates and dentist visits, eye doctor visits. So we just wanted to see how the trends were stacking up nationally rather than just in our isolated Jamaat community.
Okay, so the national survey worked amazingly. We got national results via our data analysis team, which did amazing work in using some amazing statistics testing, they found our results, which again, high vaccination rates, strong dental and eye checkup rates, but the same things were lacking. We weren't getting our screenings. You can see here that the national average and our gaps were incredibly large. We didn't have HPV vaccination rates, limited mental health help seeking, lower colon, cervical, and cholesterol screening. We were very fortunate, again, to be invited to the American College of Physicians conference, where they once again highlighted these points for us. They questioned why we had primary care physicians, but these physicians weren't recommending for us to get these screenings. They were. We just put the stigma on them that it's private. We shouldn't be getting these screenings. But despite it being private, it's also important. If we don't catch these diseases early on, they can turn detrimental. So we hope that through our research, we can use Project Barakah to nationwide convince people that these don't need to have a stigma on them. They need to be looked at. We need to be getting help for these diseases because it's important.
And so yeah, this just shows that we caught attention not only of SBMAA, but of the general population of America as well, because what we've done here, we can really be implemented in different religious groups as well, and not even religious groups, just groups in general, to really assess how the communities are stacking up against state averages and national averages and et cetera, and overall improve the health of the community in the long run. So we just want to, again, say thank you to Dr. Major Salman Fidahussein for mentoring us throughout this whole project, and Dr. Amil Jamali for taking us under his wing and also mentoring us along with SBMMA. We also had a fantastic team of statisticians and data scientists, including Mrs. Munira Fidahussein, who's really helped us compile all this data together and break through if it's significant data, insignificant data. And so, yeah, Amatullah, do you have anything you want to add?
Thank you so much to everyone for allowing us to present here today. Again, we couldn't have done this alone. We're very thankful that everyone trusted us as high school students to take on this project and to spread this data.
So that was great, really excellent. A question I have is, I think what you've identified is the incidence of vaccine screening, mental health uptake. Do you have a sense of why? I guess the next question is, do you plan a future survey to start asking why people are not taking advantage of the screenings, why they're not going to mental health? I think we can all imagine reasons, but it'd be curious to actually collect that data.
I feel that there is so much more data we could collect because of what we've already found, and in the following years, as we continue to expand Project Barakah, more surveys will be sent out figuring out why all of these results were as they were. This is just the starting phases of this, and we're very excited that we even collected this much data, and hopefully we can roll it out even farther and answer these questions.
It's a comment more than a question. You may have already said this, but Taha and Amatullah both are high school students, and this is truly incredible to see you guys up here presenting. What a great project under great mentorship, but also just the fact that you guys have the confidence and the support to come up here and do this at such a young age is truly incredible. They also submitted a really excellent abstract that may or may not have been the top abstract. Please take a look at that poster today. Just keep up the good work, guys. Really proud of you.
Thank you.
I think, thank you, Dr. Batulben, but I think most of the audience will echo her comments. And as part of the organizing committee, you guys have an open invitation to come back and present your new findings and your new developments at every conference, and really looking forward to see where your path takes you.
Thank you.
Yeah, congratulations on your initiative. I was just curious because you mentioned you had 187 responses, which is excellent. Do you have an idea of what percentage that was in terms of your whole Jamaat that actually responded? And how did you deploy the survey?
So we actually sent out 120 surveys, and we got 84 responses around there. And so, yeah, that's a great question. So again, we employed the use of our community, right? We had youngsters who would help the elderly who did not know how to fill out the survey. They would encourage them to fill it out. We had QR codes posted across the Jamaat, encouraging people, hey, fill out this survey, we're doing this initiative, we want to see how our health stacks up, right? And then so we had around 80 surveys received out of 120 sent, so yeah.
Screening based on the age group, right? Were patients above the age of 65 less inclined to do the screenings compared to breast and 65? Because I think the preconceived notions about privacy, and it probably has to do with the generational gap as well. So I don't know if you guys got a chance to look into that.
Once you entered your date of birth, the cancer screening only showed for the things that you will qualify for. So if you entered female, it will not ask you questions about prostate cancer. If you entered your age as 25-year-old female, then it will obviously block away certain things like colonoscopies and stuff like that. So we did make the survey a little bit smart in a way that it will only show you the things that you wanted to and try to make it less than 3 to 4 minutes so that people stay engaged. So we did play around with that a little bit, but I think the opportunity is incredible on how do we refine this survey further. Because then when we started collaborating with Dr. Jamali, we realized that our questions were good, but there were a lot of opportunities there. And in addition to that, I think there is hypothesis of why those gaps exist, right? We believe that perhaps abnama, people don't want to get their breast checked, right? Mammogram is manenati kaptu kai koi mane vinam pade, right? Manenati kaptu ke hun pap smear karwa jao. Ya to na mane ya am said lage che pan hun pote samji leis, hun pote kari nakis. So there's theories around it, but do we truly understand if our theories are true? So I think the next, and I've told them as well, next Ramzan, what they need to do is mentor the future, right? So find more high school students, take them and say, okay, what does the next thing looks like? What's our next question? Do we want to understand the gaps further? Or do we want to do a calcium coronary screening thing? Or do we want to find out how many A1Cs are actually abnormal without people knowing truly that are? So I think the ideas are robust. And I do think that we will continue to find more answers. And I think we are, as physicians, we like to solve problems immediately, in general, right? Even when we go to administration, we're like, you know I'm busy, I just need one more person, why don't you just hire one, right? But we don't understand the research that goes behind it. And I think what I want these students to understand is it is important to ask questions, right? It is almost your right, it's a gift of God to be able to say, "Mane nati samajh pati, mane samjhao," or "Mane, I want to know more." And the idea of this project is to learn more. Not necessarily, I have an answer, but do I understand why, what is happening? And keep your curiosity out there and keep asking more questions so you can understand our Jamaat, our diseases, and our gaps better. Does that make sense? Yeah.
I have a question. Dr. Inshallah Tahabai and Dr. Inshallah Amatullah, we really appreciate what you guys have done, and it's an amazing thing that you have achieved. The question here is that data is a very, certain medical data is very dangerous. So when you are taking this survey, how and what type of counseling did you get to handle this data? What is the legal implications behind collecting data of a Jamaat and then presenting that data in your university, in your school, college, and wherever you are presenting it? So what are the legal implications of collecting this type of data? And you must have taken some counseling before collecting this data. So can you share that with us, please?
We were very fortunate again to have mentors like Dr. Salman who were able to help us out in figuring out how to go about this the right way so the data was collected in an ethical way. Additionally, all the surveys did have like an agreement of sorts that this would stay confidential. However, we would use it for things like this in which we presented the data out there. So everyone was aware of where the data would be used and how the data would be used, and that names and specific things about each person would not be shared.
Hello. Fantastic presentation. Really grateful that we could experience this and hear it from you guys. I had, in terms of asking questions for the next steps, I also think it would be a really good idea to ask the good questions as to what are the protective factors that our community provides us that gives us good outcomes. Like people are getting their screenings, getting their blood pressure checked. What is it about our community and our Jamaat, our respective Jamaats, that is making us do this? Because I think compared to other communities and other cultures, we have a culturally protective factors which would be really interesting to figure out as well.
Yeah, I think, again, we've collected all this data, and there's so much we can do with this data moving forward, such as more in-depth surveys, more in-depth research as to why all these results were found and how we can use these results even farther.
Just want to say I'm a licensed clinical social worker. I'm not only a care coordinator, but also I have my own practice as a mental health therapist. So I get so excited when anybody gets that stigma, when that stigma starts to decline. I think that's wonderful. So kudos, keep on going. And I did hear throughout, even yesterday and today, the different comments in reference to social work support, connecting the different resources for our community. So I'm all in it. Whoever can use my support, please let me know.
So great initiative, and I hope it can be a longitudinal study, just like the famous nurses study. So year after year, we can get some more information.
Yeah.
I think the hope is, just like we have at Mayo Clinic, right? We have this robust data of cardiac diseases, and we continue to use the same cohort to do more research. We have such an amazing resource and ability to collect data, to be able to do so many beautiful things with it. And I don't think we have tapped into it. Now with the use of SBMAA and our access to all the Jamaat, if we have this robust data, the number of publications and the research and understanding of the disease within the community that we can have can be outstanding. I I think the sky is the limit at that point.
Also, there's potential regional variations. There's a huge regional variation. Absolutely. So I was just going to say there's a huge regional, United States is undergoing a culture shift, and there's a huge regional variation. And this data can be parsed by regions, by politics, red states, blue states, vaccine uptake. There's very much different things that we can do with this data to really drill down and see where we need to focus our community health efforts so that we have maximum impact on Mumineen's health going forward. So we're focusing, just as these kids started to ask, we're focusing on the right questions that need to be asked and not just the questions we feel like asking.
आमिर भाई हमने जो जिक्र थे सो भाई साहब अपना जिक्र किए कि with this data it gives us a lot of leverage, including leverage with decisions made by policymakers. The regional variations, the national variations, all of that has a huge impact on policy decisions that are made by the American College of Physicians, by other, the AMA, whoever makes those policy decisions. Those can be informed by this data.
Very, very good. I think we have time for one more question, perhaps two more questions, and then we'll call it.
Amatullah bin Taha, thank you for your presentation. You guys were doing this respectively in your Jamaat in Atlanta. I'm assuming the other high school students in your Jamaat were seeing you do all these things. What was their impression? What was their impact? How can we mobilize kids in our respective Jamaats to take on that same passion and bring these types of initiatives there as well?
Do you want to take this one?
Yeah, so our main goal is that me and Amatullah, we can also mentor the next people who are going to continue this year after year. So the main goal that we have is, so everyone was very interested. We had people, as I said earlier, they were sending the surveys to people, helping out everyone fill out the surveys, and then helping with the clinics and things like that. So yeah, it was like a very big community effort, and a lot of youngsters were also interested in taking a part of what we are doing here, and which is what we intend to do in the future. We intend to take them under our wing and continue this survey year after year and see how we are growing as a community overall. I hope that answers your question.
But I think the representatives of Jamaat who are here, if you identify kids in your Jamaat, I think it's hard when you have so many people involved in doing the same thing as opposed to dividing what it is. Now, all the youngsters were involved, and I think the most exciting thing that I will tell you guys was the youngsters were engaged. Everybody is so engaged in there. They want to do khidmat, right? But this was the first time they were almost doubtful. I don't know if it's going to be scientific. There was almost a little bit of they always do this, but I'm not sure if it's going to truly follow a scientific method. So initially, there was a little bit of a pushback from the youngsters. Okay, well, I'll get involved. I'll see how it goes. But when they started seeing that we are doing this in a way that is actually following a scientific method, then the interest picked. And since then, we have had so many youngsters come to us and say, what's the next project? How can I be part of it? I want to be presenting as well. I want to be involved in a science paper, right? These two young junior in a high school and a senior in a high school have publications now in ACP and in journals as well, which is... which puts the stage on what I emphasized in the beginning. There is absolutely no reason that there should be any child in our Jamaat who should not be uber successful. Our entire future generation in America should look very successful. And we have the resources, we have the mentorship, right? We have everything in place to make sure that every child, as long as they put their efforts in place, can be super successful. Imagine a generation of the next after us who is absolutely successful. Every Jamaat is uber rich. We are able to do everything we can and save the world. What an amazing thought, right? But yes, let's get kids, high school children, college students, right? It doesn't have to be high school. It can be college students, it can be medical students who want to be involved. Let's collect their names. Let them form the group and decide what our future should be. We can mentor them, but I think they have the power to change the future.
the only comment I would make is this is, think about these young kids, junior, senior, it's like how much effect would they have? This is about impacting the health of our community, changing their mindset, health literacy, education. You haven't had a mammogram. Let's convince this senior to have a mammogram. Let's convince this person to have their health screenings done. It's like so impactful about health literacy in our community, which is very low as compared to other populations. So that is the main important thing that we need to learn and bring across our community.
I'd like to thank everybody for their comments, and I want to just point out to these kids, you know, just to not to put too fine a point on it, what they've done is, under mentorship from senior physicians, utilized medical research, data science, to advance the health of Mumineen and obtain Mola's Khushi. And if that's not what we're here for, then there's no point. So they've checked all the boxes, done all the things, and they deserve another round of applause for their hard work.